Hello nurses! Today we're going to learn about CBI or continuous bladder irrigation, also called closed bladder irrigation. This educational material is designed for novice nurses. The topics we're covering are Introduction to CBI, Indications for CBI, Nursing care for patients with CBI, when and how to perform manual bladder irrigation, documenting the procedure, and the last one is patient discharge instruction. Introduction to CBI. CBI is the ongoing infusion of a sterile solution, usually saline, into the bladder, while simultaneously draining urine from the bladder. It helps prevent blood clots so urine can flow normally. CBI is a sterile procedure and is done using a three-way catheter that looks like this. The patient end of the catheter is inserted inside the bladder through the urethra. The external end has three tubes. The first is used to inflate a balloon which retains the catheter tube inside the bladder. The second is attached to the drainage bag for the urine. And the third is attached to two irrigation saline bags which hang from an IV pole. When CBI is used. CBI is used for many things like administering medications directly into the bladder, flushing bladder calculi, or to prevent clots after urological surgery. One of the common surgery is TURP, or transurethral resection of the prostate. In my ward, most patients who has CBI arrive on the floor with CBI already in place. Occasionally, we do initiate CBI in the unit for patients who develops bloody urine. Just like a regular Foley catheter, a doctor's order is required to place a CBI. When inserting a catheter, it's a good idea to have another nurse present to help you maintain sterile technique. Nursing care for patients with CBI. As nurses, it's our responsibility to both monitor and educate the patient about CBI to keep them safe and free from complications. First, we need to maintain irrigation. Check the lines frequently to prevent kinks, looping, or blockage. Make sure the solution is running freely. Assess the urine for color, amount, clots, and sediments. Then, adjust the flow rate of the irrigation based on the output. The goal is to keep it light pink. If urine is bright red or has clots, increase the rate until the drainage is pink. Measure inflow and outflow volume accurately. Outflow volume should be greater than inflow volume. Monitor for pain and retention. Bladder distension, spasm, and pain may indicate a urine blockage. If there's no blockage, offer patient medication for pain as ordered by the doctor. Monitor for bleeding. Some hematuria is okay, but too much blood is no good. If irrigation clamp is wide open and the urine is still bright red, has large clots, looks like Merlot wine or ketchup, notify the doctor immediately or call rapid response. Monitor the patient for signs and symptoms of shock. Prevent infection. Maintain aseptic technique when draining the drainage bag and spiking new irrigation bag. Keep drainage bag below the patient's bladder and not touching the floor. Provide good hygiene, meatal care, encourage incentive spirometer, early ambulation, and all the good stuff. Provide patient education and prevent catheter dislodgement. The patient may be confused immediately after surgery or may forget that they have a catheter. stabilize and secure urinary catheter to prevent accidental dislodgement. Educate the patient about the CBI, and provide emotional support. So your patient reports bladder distension and pain. We perform bladder scan and it shows 800 ml of urine in the bladder. The urine is not draining. The drainage tubing is free of kinks and dependent loops. What do we do? Manual bladder irrigation. It is performed to remove clots and sediments that may be causing the obstruction of the catheter. As much as possible, manual bladder irrigation should be avoided because it breaks the closed system of CBI, which increases the risk of infection. An MD order is required to perform manual bladder irrigation. To perform manual bladder irrigation, you need sterile irrigation kit with 60 ml catheter tip syringe and an irrigating saline solution. It's best to do this with another nurse to help maintain sterile technique. First, clamp the irrigating tubing. Wipe connection point between the catheter and drainage tubing with alcohol swab. Then disconnect catheter from tubing, allowing any urine to flow into sterile collection basin. Next, take the syringe and aspirate 50 to 60 ml of saline. Insert the tip of syringe into lumen of catheter and gently push plunger to instill solution. Once saline solution is in, gently pull back on the syringe plunger to remove the drainage. You can expect clots to be aspirated during this process. Repeat saline instillation and mild aspiration until the return solution is clear or the drainage catheter is no longer obstructed. If the clots cannot be cleared, notify the doctor. The catheter may need changing and you will need a doctor's order. Documentation. In our nursing notes, we're going to describe how the patient is tolerating the CBI, color and type of drainage, if manual irrigation was needed, education provided, and an accurate intake and output. CBI flow sheet. To better keep track of intake and output, we use the CBI flow sheet in our unit. First, we number the irrigation bag when we hang them. For example, a patient arrives at the unit with empty drainage bag. We start infusing bag number 1. Throughout the course of infusing saline bag number 1, we empty the drainage bag as needed and record it in the output section. When saline bag 1 is empty, we drain the drainage bag and total all the output, then minus the input. That is the estimated urine output. Then you start the whole process again with bag number 2. I like to bold the line in between each irrigation bag to keep track of the urine output better. Patient discharge instruction. Patient may go home with the 3-way catheter with the irrigation port plugged. We need to teach them how to take care of the Foley catheter, switching between the leg bag or the overnight drainage bag. They need to drink 6 to 8 glasses of water every day unless it's contraindicated. Teach them to avoid fluids that can irritate the bladder like soda, coffee, beer, wine, or alcohol. They need to eat food rich in fiber to prevent constipation. And teach them about activity restrictions. They can shower, but they cannot take a bath or go swimming. No lifting greater than 10 pounds. No strenuous activities. No sexual intercourse for 4 to 6 weeks. Teach them about their medication upon discharge and to go to their follow-up appointments. We are also going to teach them the signs and symptoms when to call the doctor. Signs of infection, which is fever of 100.4 Fahrenheit or higher, chills, pain, foul-smelling urine, burning or painful feeling in the bladder, the urine is not draining, bleeding or bright red bloody urine, or when there is a catheter dislodgement. We are also going to teach them the signs and symptoms when to go back to the emergency department or call 911, which is difficulty breathing, if they have chest pain, signs of stroke, and any acute change in mental status. If you have any questions or clarifications, please write in the comment section. If you enjoyed this video, please hit like and subscribe. Thank you so much. Until next time.